These are the people that are hearing my speech. The speech I'm giving is on OCPD, Obsessive Compulsive Personality Disorder. One in every 100 people is affected by OCPD, even more are affected by its symptoms. Obsessive Compulsive Personality Disorder is a disorder which involves an obsession with perfection, rules, and organization, which leads to routines and rules for ways of doing things. According to Dr. Stephen Phillipson, a person with OCPD is comfortable with their high standards and rigid mindset. In fact, a person with OCPD will justify their actions instead of admitting any sort of problem, which they blame on the environment or external circumstances. A person with this personality disorder has symptoms of perfectionism that usually begins in early adulthood. This kind of perfectionism can take a straight-A student and cause them to flunk out of college. Because they try to do everything perfectly, they procrastinate assignments, and when they do, they can't complete them because their standards are so high. What are the symptoms of OCPD? According to the Diagnostic and Statistical Manual of Mental Disorders, for a person to be diagnosed with OCPD, they must have the following symptoms: preoccupation with details, rules, lists, order, organization, or schedules to the extent that the major point of the activity is lost. They give too much attention to trivial things, which makes their normal routines difficult to follow. For example, some people affected by OCPD feel the need to be obsessively clean and organized. While many are indeed clean and orderly, even those who aren't feel the need to set up symptoms to maintain cleanliness, whether they actually follow through or not. Perfectionism that interferes with task completion. Due to this, they are often indecisive and they procrastinate. Since making the right choice is so important, making even the simplest of choices can be difficult. Their indecision often holds them back in life. For example, if they need to find a job, if there are too many jobs, it makes it a very difficult task. And since always making the right choice is impossible, it becomes a regular source of discomfort. Overly stubborn and inflexible about matters of morality, ethics, or values, and about having things done exactly their way. People with OCPD view all actions as either right or wrong. There is no in-between. Of course, a person with OCPD is always right. People with OCPD always feel the need to be right, which affects their personal relationships. They need to be in control, and when they aren't, they withdraw emotionally. According to the cognitive model of personality disorders, they think of themselves as responsible and hardworking. Inability to discard worn-out or worthless objects even when they have no sentimental value. 20% of people diagnosed with OCPD have compulsive hoarding as their primary symptom, and 43% as their secondary symptom. These people usually have a relative who also hoards, so it is genetic. Now that I've told you about the symptoms of OCPD, I will tell you about the causes. What are the causes? According to the Gale Encyclopedia of Mental Disorders, no specific cause of OCPD has been found. However, faulty parenting is known to be the major factor. In studies, researchers found that people who have OCPD as children were punished for every mistake and rewarded for almost nothing. Today, we've learned the main symptoms of OCPD and what causes them. Obsessive-compulsive personality disorder is a disorder which involves an obsession with perfection, rules, and organization, which leads to routines and rules for ways of doing things. If you have all or some of these symptoms and they affect your life negatively, you can get evaluated. In addition to the 1 in 100 people is affected by this disorder, many more who are also affected by his symptoms can get help too. With proper help, people with OCPD or its symptoms can gain control and lead a rich and fulfilling life. Okay, we're done. If you don't